I did a virtual consultation on corrective hair transplant, and in that virtual consultation, I was really focused on talking about correcting prior bad hair transplant work. This virtual consultation is talking about fixing scars or other types of diseases that are there that could be corrected. For example, I have a lady on my website you can see has a big circular patch on the front that is a skin graft from prior basal cell carcinoma, and we did in a single session. We built all that hair. I've done linear scalp scars, which I'm going to be talking about in a separate virtual consultation. But if there's different types of scars on the scalp, other areas, that's what I'm talking about with this virtual consultation, is how do I correct scars? So also facelift scars, brow lift scars, how do I fix those scars with hair transplant? So first of all, that whole background is thinking about, as a hair surgeon, I got to figure out, do you have enough hair to do it? Are you safe for me to transplant this scar? That's a whole discussion that I have to look at you and make a decision with. So we're not going to talk about that. I'm just going to talk about how to correct these scars, because I see this almost every single week. Someone coming in panicked about their scar, and how do you fix this? The biggest question I have is, with scar tissue, will the graft survive? That's probably the whole gist of this entire virtual consultation. And I will say I cannot guarantee it, obviously, but I have had a very, very, very high success rate with transplanting scars, even after a single session. Why would that be? A lot of reasons. Number one is I look for deep blood supply. So if I'm not seeing blood supply coming back, then I can't really transplant it well, but I'm looking for that blood supply coming back during the transplant. But I also preoperatively feel for what the depth of that soft tissue is. So if you've got a good soft tissue, and I know that that area should have enough blood supply, but I can always test it preoperatively if I have any question of it. So thickness of the tissue, blood supply coming back, and the technique. So some scars, if they're like in the back of the scalp, I'm going to talk to you about that as a separate one. I'm using punch grafting, where I'm actually taking the scar out visually. On other areas, I don't use punch grafting, especially toward the center of the scalp, because that area actually compromises the blood supply. So I'm using larger slits that allow me to get more of the healthy, robust hair tissues in there. A colleague of mine actually did some really interesting work in scars. He looked at diseased tissues of the lower extremities or the lower legs, where there was diabetic ulcers that were not healing in nature, and he put hair grafts in there versus just skin grafts. So he had hair grafts on one side, skin grafts on the other. The hair grafts actually restored the entire diabetic ulcer, whereas the skin grafts failed to do so. Why is that? Hairs have potential stem cells. They have the regenerative capacity to help heal skin. That's why when I do a full phase laser on the face, I can go pretty deeply and the skin will restore itself. Whereas in the neck, there aren't those oil glands, there aren't those stem cells, there aren't those hair follicles to get the restoration. So I can't go so deeply in the skin when I'm doing a laser, because it can scar the patient. So it's the same principle of the scalp. So when you take these beautiful hair follicles and place them to scar, there are several cool things. One is they oftentimes help the scar tissue look better. They actually can restore the scar. It can actually allow future transplants to be even more successful. It sounds counterintuitive, because you think, well, I'm putting in grafts, it must damage the blood supply even more, and then now the second surgery would not look as good. But that's not the case. Oftentimes they actually provide better supply, but blood supply, just by putting the hair grafts in that area. So that's an interesting component as well. But I have found that the hair transplants survive extremely well in scar. That is due to the technique of how I do it. Also, it's how my staff gently place the grafts rather than traumatically inserting it, understanding depth of the graft placement and making the graft fit the site well. And there's a component of regenerative medicine. Regenerative medicine I describe it as fertilizers. Think about a pot of plant. If I take a plant out of one pot and I move it to another pot, that's essentially what I'm doing with hair. I'm moving it from one part of your scalp to another. But let's think about how plants grow, how flowers grow. They need fertilizers to grow better. They need sunlight, they need water. Well, it's the same thing with hair grafts. For 10 years, I was just doing regular grafts. In the last 10 years, I've actually changed it now. I've been using PRP, platelet-rich plasma, ACell, which is a acellular porcine bladder matrix, using ATP, you may have remembered that from high school biology, and hypothermosol, which is a storage medium for liver transplants or organ transplantation. And I found incredibly high survival rates with this. A colleague of mine actually looked at one side with an irradiated, so in other words, radiation side with scar, compared to the other side that did not have that. He transplanted grafts on the side with normal saline as a storage medium. On the side with the scar, he kept it out of body for a few days with ATP and hypothermosol. He found a much higher growth potential in the side with scar, and even leaving it outside of the body, which is almost unheard of. So I have had tremendous success, not across the board, not 100%, but very, very high, almost across the board, of having very high success rates with transplantation in scar tissue, whether the scar tissue is due to brow lifts, due to brain surgery, even with people that have had chemotherapy and radiation. Take a look at my scar correction before and afters. These are all my before and afters. You can see the diverse ways that I've transplanted people with bad facelifts. I don't do facelifts where I lose hair, but unfortunately 99% of doctors that do do facelifts lose some hair because of the technique they use, and I don't lose any hair when I do this. But that is, I can fix those losses, traumatic scars across the face or the back of the scalp. So that scar correction is what I'm really talking about, not FUT strip scar, which I'm going to talk about separately in a video, but just talking about scars that you would think won't survive well. But actually for those patients, I also encourage them to listen to this virtual consultation, because it just talks about in general how to correct scars and how survival is really something that I find to be very high in my hands.